doctors of Reddit, what is your most surprising? I cannot believe I need to have this conversation with an adult story. Paramedic here. Was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. So when cats and dogs eat grass, that means they have cancer. Right. Meow. Number no, it does not. Made for an awkwardly silent ride the rest of the way. Laughing. WTF. And really, why did he even assume a paramedic would know whether or not animals have cancer? Not a clue. I had no idea how to respond to that question. Maybe I should have given him my vet's number. Save your life. Sure. I got this. Does your cat have cancer? Way out of my pay grade. Well, it looks like she is about 30 days pregnant. Congrats. How can she be pregnant? She is only around her brother. Well, actually they do not follow the same moral code as you or I. Veterinarian. My fragile sanity wishes you had started with veterinarian, lol. Not a doctor yet, but an ER tech for 2 years. Mom comes in with her baby plus 2 more older kids. Complains that the baby has not pooped in a while and won't stop crying. As I am settling them in with one of the nurses, the baby is bawling. Like opera singer lungs bawling. Suddenly Mom whips out a white plastic shopping bag and sticks an end in the kid's mouth. Says this is the only way she stops crying. Nurse and I share a look and immediately order an emergency x-ray on the kid's stomach. Turns out she had ingested a good amount of these bags and it was blocking up in her stomach. Big deal. Potentially life-threatening. When we confront the mom about her baby feeding habits, her only words of defense are, well, I checked all over the bag and I could not find anything that said non-edible. TLDR, Mom had been letting her baby teeth on plastic bags because she did not know they were not edible. God hope this mother lost custody of her children. That the 30+ cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try to decaf. 30+ man, I am such an amateur. Your heart thanks you for your amateur ways. This will be a long story. When I was an internal medicine resident, I came across a very nice 50-year-old Dominican lady. She was well-mannered, but one could tell she was not the sharpest tool in the shed. As I was prepping her chart for our first visit, I noticed that she had been seen by every single digestive disease MD in our hospital system. Not only that, she had had every single procedure in the book, ranging from endoscopies up both holes and culminating in an exploratory laparotomy. You are opened up to basically look inside you and we have no clue what is going on. All of this because for years she had one single complaint. She reported severe gnawing pain in her stomach. At this point I should mention that she was Spanish speaking only. Not only that, she had a very heavy Dominican accent. And I was the first Hispanic doctor to ever see her. My first language is Spanish and even I had difficulty understanding her. So she comes in and after exchanging some first-time pleasantries, I politely ask her how she is doing. Sure enough, although she was smiling and said she felt well, she pointed at her belly and said it was biting again, and asked for the cream to kill it. At this point I got intrigued. Her medication list only mentioned a cream used for herpes breakthroughs. The previous fellow only mentioned in his note that in every single visit she only asked for the cream and nothing else. When I asked what she meant by the biting and what she intended to do with the cream, she very calmly tells me she intended to stick the cream up her ass in order to kill the bird living inside her. After delving more deeply into her story, it turns out she did not have a medical condition. Ever since she was a little girl, she believed that after eating whole quail egg, the bird had spawned inside her and gnawed away in her insides whenever she was very hungry. After a short visit to psych, she was diagnosed with a somatic type delusional disorder. No amount of medication or psychotherapy will cure her, but she was still a fully functional mother of 2 who paid her taxes and had 2 part-time jobs. I reached out to every digestive disease doctor in our hospital system once more, to make sure she never receives an inappropriate invasive intervention. I have been following her now for 3 years and she is happy as one can be, considering she has a bird living inside her. TLDR, lady complains of pain in her belly. Worst case of lost in translation ensues. Gets very invasive medical procedures. Turns out she is just cuckoo. While in dental school, my friend pulled out several bombed-out technical term teeth on her adult male. After the procedure was finished and post-op instructions were given, the man asked, "So when should I expect my new teeth to grow in?" He was serious. My S, capital O, is a med student. He helped to diagnose a 40-year-old woman who finally sought out a doctor after having open, festering wounds on her entire torso for over a year. The open wounds only appeared after more than a year of painful, visible lumps on her breasts. She had never sought treatment prior to this. Capital S, capital O, had to inform her that her entire body was riddled with cancer, that there was no treatment to help her, and that she would be dead very soon. Her sister, who was there the entire time, began loudly proclaiming what a shame it was that nothing could ever have been done, and that hopefully someday we would be able to detect cancer sooner. Capital S, capital O, watched a doctor explain that pretty much any other woman in the country would have gotten effective treatment at the first sign of the lumps. This was during Breast Cancer Awareness Month. I saw a patient who was concerned because she was still lactating, despite the fact that she stopped breastfeeding her twins 2 years ago. She said, "Sometimes I wake up in the middle of the night and find my husband sucking on the breasts. He says he is trying to drain the milk for me." I had to explain to her that breastfeeding her husband will lead to continued lactation. Husband had been getting away with his weird kink for 2 years. Impressive. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. I worked at the vet clinic when I was in high school. One day a vet came out of an exam room and asked me how to tell whether a puppy was a girl or a boy, thinking it was a joke or a trick question. I said, "You flip them over and look." "Right." The vet sighed and walked away. Apparently this client, who fancied herself a breeder multiple litters at this point, expensive breed, had asked dead seriously how you tell if a puppy is a boy or a girl. I had to explain to a client that just because his puppy had nipples did not mean it was a girl. "I have got nipples. Could you milk me?" Medical assistant to a cataract surgeon here. If you ducking sleep in your contact lenses long enough, they will fuse to your eyes and will need surgery to have them removed. Yes, you can go blind from this. For the love of God, do not sleep in your contact lenses. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like as a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she is now handicapped and it was not to help her walk on her post-op knee. This is the first response that genuinely made me laugh out loud. I can just imagine some cranky old woman swatting people out of her way. I have a cranky old woman story for you. My mom worked at a nursing home as a cook. They ended up having to take away the electric wheelchair of a resident that was 107 because she kept running people over when they made her mad. She was my mom's favorite resident. I knew someone from primary school UK who had one arm, and during his later years of secondary he actually got a prosthetic arm. It was a pretty good one, however he would sometimes remove it and hit people with it and broke it within the week. Talking to the children powers of nursing home residents about vaccines. Most will just sign the flu shot form. Some believe it will give their 90-some grandpappy autism. Pharmacist. But comment still relates. Had a lady calling complaining that their husband's Viagra was not working. I then went on to explain to the patient's wife that in order for the medication to work, the patient needed some sort of stimulation. The lady just screamed aloud at me, and then hung up the phone. Still my favorite Viagra story. Client brings in her dog for a tick she tried to burn off. Looking, I see it is a nipple and tell her this. She says, "But he is a boy. How can he have nipples?" I say, "Madam, your husband has nipples." Blank stare. Then light bulb moment for her. My friend is a student doctor and is on placement at a small town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. Not a doctor. But I regularly have people come in for eye examinations because when they take my glasses of things are blurry. Often these are not passing comments during the exam, but the main reason for their visit to the clinic. Duck off. Why do they think they wear glasses? Something is ducky. During residency in an urban USA city, I was in clinic. A very pleasant 50s-something lady came in for a physical. Everything was going fine when she casually asks if there are any new vaccines out. She was up to date with everything, so I asked if she had any specific concerns. She was casually asking to see if she could vaccinate her gay adult son against homosexuality. Very nice. Always had a smile on her face. Even when I broke the bad news to her. I am not sure what it says about me that the thing that bothers me most is that vaccines are preventative. So even if one did exist, you would not give it to someone you already know is gay. It probably says you are not too surprised by examples of homophobia and value factual information. So good on you, mate. Patient comes to ER. 19-year-old male. I am getting his history. Why are you here today? Every morning when I wake up my stomach hurts. How long has it been hurting? All my life. Well, what is different today that has made you come here? My girlfriend does not think that is normal. More questions. Exam by ER physician. Lab tests. The abdominal pain always goes away after he eats. Always. He wakes up hungry. He thinks it is pain. Not a doctor. But I'm a former Special Forces medic and I treated indigenous populations in Iraq, Afghanistan and several other Middle Eastern countries. Some of the patients and their families asked incredible things of me, such as putting brains back inside after an explosion took half the head off. But I have never been as incredulous as when I had to explain wrong hole to a very old tribal elder who was wondering why he could not father any children. That first one is kind of heartbreaking. Yeah. The patient was a young girl and the explosion was intended for us. There was nothing to be done, unfortunately. My mom tells it so much better. But here is a try. My mom was the head nurse at a clinic here in Houston in the 80s. She worked for an old World War II doctor that had gone into private practice, old school GP, when he returned back to the States. Well, one afternoon she told me that they had a patient come in that was running a high fever and was complaining of pain in her pelvic area. Mom also tells me that there was a stench coming from the woman's lap that could only be described as enough to gag a maggot off a meat wagon. She begins to interview the patient, who told her that her and her boyfriend had been sexually active and that she has been in pain since. She thought that the woman may have contracted an STD and asked her to undress and wait for the doctor to examine her. The doctor arrives and closes the door, only to reopen it a few seconds later, mentioning about the need for fresh air. The doctor noticed that there was a vaginal discharge, began to question the patient about her sex life. Was it protected, non-protected, etc.? According to Mom, the patient told her, "No doc, we always use a rubber." The doctor looked down, then noticed that there was a small rubber band extending from the woman's vagina. The doctor reached in with his gloved hand and pulled it out. What came next can only be described as a magician pulling the magic cloth out of someone's mouth. One rubber band after another came out over the course of the next 10 minutes. Finally, once they were all removed, the doctor had the talk with the woman about sex education and that rubber bands were not a successful contraceptive and not what they meant by wearing a rubber, and then wrote her a prescription for ABX. TLDR, Mom was a nurse who had a patient use rubber bands as a contraceptive device who ended up with a severe infection and required medical attention to get them removed. That is disgusting as heck. But I wanted to comment mostly because you used the phrase "gag a maggot off a meat wagon," which I have never heard anyone but my dad say. Funny to see it in the wild. Not a doctor. Dental hygienist. Had to explain that brushing your teeth with Comet the cleaner was not a good way to clean your teeth to a 40-year-old woman. Also had to tell a woman that painting her teeth with white fingernail polish was a bad idea. I saw an episode of My Strange Addiction where a woman would eat a little bit of Comet a couple of times a day. This behavior arose due to sexual abuse during her childhood. Eating Comet made her feel clean inside. The show had her go see a dentist where she learned that she had to lose all of her upper teeth and most of her lower teeth due to the damage the Comet caused. A 32-year-old grown man asked me if the hot spells he was experiencing at night meant he was going through menopause. I had to explain to a grown man I still work with that tampons do not break down in a woman's urine after they were finished using them. He has been married 12 years. It was not his best day. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I have lost weight. And you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you are looking for a community to serve, the Amish can truly use your help. I could write a book about the things I have seen.